June is Men's Health Awareness Month, and it's no secret that men sometimes don't take the best care of themselves.
Joining us live in studio right now, Dr. Matt Cirrullo, who is a primary care physician with Atrium Health. Dr. Cirrullo, thanks for being here with us this morning. And just starting off, how do we get men to come in and see you?
I think the correct answer is beg and plead.
Yeah, yeah, exactly.
It's very difficult. You know, I think a big issue with men in general is that we tend to neglect our bodies and somewhat abuse them. We're kind of mindless, and we always pass around that phrase, that catchphrase of man up, right? And so we tend to just ignore and push down our problems and just keep going. You'll find, and if you haven't heard yet, but partners, fiancés, you know, couples, it tends to be the partner of the man that really brings the man into the patient, into the office as a patient.
So how do you, being in that category, how do you lovingly push without nagging? You know, and
we should ask my wife.
Exactly. And get them to actually be receptive and to empower them to want to be there, because men are a big part of our lives and we need them healthy.
Yeah, really, you know, what I try and do to my male patients is just remind them that it's just like a car. I'm a very automotive person. I think about cars and I used to tinker with them. But I tell them, you know, most men own cars, drive cars. Hey, you are supposed to take your car in for a checkup, right? Right? You wouldn't walk around your car, see a flat tire and go, let me just keep driving on it, right? It's kind of this persistence of, if you want to stay healthy, get checked out and stay on top of it. And it's really just motivating them that, you know, as I would say from a partner standpoint, if you ever hear something that comes up, just say, hey, instead of offering ideas, suggestions, just redirect them to going and seeing a doctor. Yeah. Right?
I know for a lot of men, it's not until something hurts or it gets to that point of almost no return where they come in, but just because you don't have a gas light on doesn't mean you're not low on gas, kind of keeping the car analogy. How important is it to, even for the men watching that feel fine, to kind of pay attention to that checkup and maybe see what's going on under the hood?
Yeah, exactly, right. I have a tendency to run down on E. All right, I'll be the first to admit that. But we all know that there's things that can be brewing inside of our bodies that we have no symptoms for. We couldn't even imagine it's happening until the worst happens, right? Uncontrolled blood pressure is a very common occurrence, even in my office, amongst men. And patients do not feel that. They won't know until it's too late. Severe headaches, dizziness, feeling like they're going to pass out, chest pain. And it's really coming in and just having a simple blood pressure check once a year to see if there's actual hypertension occurring. And for men, it's actually about 52% of men will develop high blood pressure. Wow. Can you believe that? One in two men will have a blood pressure issue.
Oh, there are two sitting right here.
Okay, well, that's not good.
No, but I'm just saying, when you put it into numbers like that, it's more common. What else besides high blood pressure do you see men be more prone to or susceptible to?
So most common ones are heart disease, right? And heart disease is kind of a catchphrase we use for the different cardiovascular issues, heart attacks, strokes, you know, those are the things that also are kind of silent killers. They don't happen until, they don't get detected until a symptom develops. Those are definitely much more common in men. Strokes, diabetes is another one that goes undetected for quite a bit and just takes a blood test. Of course, most people tend to think men's health, they revolve around prostate, testicular cancer, and so forth, which of course are going to be higher rates than in women. But really, probably the most prevalent one that I've been encountering recently over the last few years is mental health. It's kind of taboo in society for people to talk about mental health. It's just not something we come up. If you hurt your knee, right, you'll have 15 people say, oh, what's going on? I know what you should do. But if I can't tell you the last time, Ted, I walked up to a friend and said, hey man, how are you doing?
Yeah.
Right? It's not something we commonly will talk about, but in the office, every day. And so it's something I'm always on the lookout for. Come into the office, I usually ask a 2-question series just to screen for any sort of mental health, which is surprising because we pick up on it a lot.
Yeah. How do we kind of, I guess, shift those activities for men? How do we lean into more of those health practices? What are some things we should focus on as men to pay attention not just to our physical health, but that mental health aspect as well?
Yeah, it's challenging, right? Unless we kind of start to shift our perspective in society and be more welcoming and aware that people suffer from mental health, it's probably going to be lagging. right? And that's kind of the effort that we've been shifting on at Atrium, is making sure we are screening our patients for mental health. And I think we're personally doing a very good job of it. The other thing is really, you know, like I just said, I'm at fault. I don't tend to ask my friends how they're doing, but we'll casually bring it up while we're hanging out. You know, oh man, I've been a lot of stress at work lately. And we'll casually just kind of talk about our stressors. And that's probably our best opportunity to say, hey, you know what, man? Like, I've got family and friends with the same thing. Like, maybe let's go see a doctor. Yeah.
We're running out of time, but in the last 30 seconds or so, your elevator pitch to any man out there watching, or a woman that cares about a man, whether it's their you know, a son or a brother, or what would you say to them?
I'd say go see the doctor. I personally am not out there to find problems and make your life worse. I'm there to keep you healthy as much as possible. Come see me, and that's my job. Keep you tuned up.
Yeah,
Yeah.
Absolutely. Dr. Cirrullo, primary care physician with Atrium Health. Thank you so much for the work you're doing and encouraging men to come see you a little bit more often and check under the hood. We appreciate it.
And well, I appreciate you both. Yeah.